morning, everyone. My name is Janet Inosanitam. I'm a licensed community health worker. So many people come to my DM to ask me if I'm actually a nurse. I'm a community health worker. A community health worker is a provider of healthcare services and advice based on formal training and experience. A health worker is someone who provides advocacy to those who need it. Also, a health worker is someone who helps people to understand their health or their social conditions. A health worker is a professional who facilitates communication between the community members and healthcare organization. A health worker is a professional that makes sure that healthcare services is affordable, easily accessible to every members and all individuals in the community. A healthcare worker makes sure that healthcare services reaches the doorsteps of the people in the community. As a health worker, you don't need to wait for the doctor, or you see someone dying, or you don't know what to do as a health worker. That's why you are being trained and you're licensed to know what you're doing with the guidelines of the use of standing order. Standing order is a guidelines that helps you to take care of your patients in an appropriate way. A health worker is a professional that makes sure that despite the uniform you're wearing, you don't care if it gets dirty or not. You're ready to arrest the situation at all costs. They can wake you up in the morning, in the night. You're ready to do your work as a health worker. Some people call us village doctors. We accept, because service to humanity is what we really want as health workers. There are so many times you see us, we go to the villages. Mainly, though, that is where health workers stay. At the village level, where they work to make sure that immunizations are being carried out. We carry out health talks. We carry out health education. We educate people in order to know their health and the type of food they eat, that is nutrition. We teach them about cleanliness, how to take care of their body, how to breastfeed their children. We also talk to them about immunization, that immunization is very, very necessary for children. You know, some people will say, after all the children have given birth to, they did not pass through breastfeeding. How come you're teaching me about breastfeeding? Do you know that if you breastfeed your child for at least 6 months, your child immune system will become very strong? There is no sickness that will come on the way of your child that the body immune system will not resist. Okay, have you ever taken a look at a child that is undergoing breastfeeding and a child that is not undergoing breastfeeding? You discover that that child will become malnourished, and there's something we call bloating. The stomach will become very strong because at the early stage you start giving the child water to drink. But do you know the good thing? This breast milk you give to your child, it contains all the 6 classes of food. All the 6 classes of food you eat as a mother. Some people say, the food I eat is not enough for the child. Even the breast milk I give to the child is not enough. The child will keep on crying. That's because the child is not satisfied. As a mother, you need to eat very well. When you eat very well, then you breastfeed your child. Your child will be satisfied. And what do you eat? Do you only eat carbohydrate? You're supposed to eat all the classes of food. Protein, fat and oil, all these vitamins. You see these foods around, vegetable, crayfish, all these crumbs. You eat all of those things so that it will make your child very healthy. And this your child will not be prone to anything like sickness. Try it. Try it. Or just go and compare a child that is exclusively breastfed and the one that is not exclusively breastfed. You see what I'm talking about? You discover that even the weight, you know, when you come for immunization, you weigh your children, right? Weigh your children. We weigh your children with weighing scale, We even use growth monitoring to even check them. And you discover that some children are severely malnourished because of sometimes the parents. I discovered that some children come out with diarrhea. Some children come out with diarrhea. And when a child come out with diarrhea like that, some people run quickly to where? TBS, traditional birth attendants. Where is the appropriate place for you to take your child to a newborn baby to? At the health center, primary health care center. That is why there is a slogan. Primary health care is a key. The key to work, key to health for all. PHC is a key. Key to what? Key to health for all. Community health is our concern. That your health is my concern. I wouldn't like your health to deteriorate. That's why all the time we advise, take much water. Take much water. Even the food you eat, you're supposed to wash it. Your vegetables, you watch them. You watch them. Even with salt, you can use to watch them. What is the essence of salt in washing your vegetable? It helps to kill all the germs. You discover that when you buy vegetables, some people, they want to do fast food because of what? They are very hungry. And you just slice the vegetable like that. You put it in your pot and you start cooking. Do you know what you're taking inside your body? You don't even bother to wash because of what you're hungry. Or you just saw mango outside, and because you have that craving for mango, you just start eating. My dear, you are endangering your health. That is why people like us, which are community health workers, we are here to teach you what you do not know. If you really listen to what I said a health worker help people to understand their health and their social condition. So many people will be working like here in this chemist where I sell drugs. I see a lot of things. Before you know, they will say, somebody out there, I complain of what is happening to me. So they say I should take so drugs. And me, as a licensed community health worker, I cannot just give you the drug like that. What the first thing I'll ask you, I'll say, Madam, have you carried out test? Did you do any test? Sometimes they say they have malaria, so they advise them to buy these drugs. I said, did you carry out test? You don't just start treatment on yourself, or people tell you the particular drugs to take, you just start taking them. You don't. The first thing you're supposed to do, you're supposed to carry out tests on yourself. MP and wider test. What is MP? MP is simply malaria test, and wider is simply typhoid test. And this is when you carry out this test, and the test is showing you positive or negative. That is when you know what you're supposed to do. You start treating yourself and not just taking drug for taking sick. Like some people, they will come to get paracetamol. They'll come to get paracetamol. And then when I prescribe paracetamol to them, this Emzor paracetamol, they'll tell me, nurse, me two is not enough for me. Two tablets of paracetamol is the recommended dose. TDS, 2 in the morning, 2 in the afternoon, 2 in the evening. So people will tell you, no, 4 is 4 I take. If I take 4, it helped me. Please, stop doing self-medication. If you don't understand anything about yourself, please, go to the nearby hospital. Or you can go to the health centers. That is why Ransukuti make sure that community health care was being brought. So that fine, if you don't have money to rush to the general hospital, you can rush to the nearby health centers, and they will attend to you. If they know that that case is greater than them, that is why we have referral services. Your case, madam, will be referred to the appropriate place, health center, where it will be appropriately managed. Please, health is wealth. Health is wealth. Please, prevention is better if you prevent yourself. You will not say it's too late, I did not hear this. Please share, like, and comment. That was Jane on the line. Bye. Always there to educate you on those vital informations. I'm back fully. Bye. Love you. Still remain your Nurse Jane. Thanks.